This project is really about hospital-to-hospital medical transfers. The regional hospitals came together, and we spent the first period of time trying to sort out what transportation was. It's a very complex issue. And so there was a learning curve for all of us to get to the same level of understanding. The second phase was around establishing standards.
There were a number of major challenges associated with this project, one of which was that there are no provincial standards governing the clinical or operational standards for the operation of non-emergency patient transportation. So we essentially had to develop and use our own standards in light of that absence. And so that was a significant piece of work on the part of the committees to develop those standards and understand what were the most meaningful areas in which that had to take place.
We established our minimum standards that we required. We then set out to work on a collective RFP, and then through that, once we established all of that, we were able to get to a contract and awarded that contract to a single vendor, which is Voyageur Transportation.
Voyageur, our contracted non-emergency patient transport vendor, has been able to utilize quality standards that we've been able to help them develop to ensure safe transfer of our patients anywhere in the Southwest LHIN.
The second challenge, and a very important one to recognize, was the diversity among the participating organizations. So we've had about 14 different hospital corporations and about 26 hospital sites involved, varying from very small hospitals to very large ones, from urban hospitals to rural ones. It was really important to bring those hospitals together in a way that allowed everybody to understand and appreciate that diversity and where standardization or common rules were really important to be established.
Then we sat down and developed a number of information packages for our staff so that they were able to consistently deliver and know how to use the various transport systems that were being made available.
This project is good for the health system because it allows appropriate use of ambulances and paramedics. We want to ensure that they're available for critically ill patients, so by using non-emergency patient transport vehicles, we're making sure that they're available for those critically ill patients. Overall, we have improved efficiency and patient flow, and it's impacting how quickly patients can now get through our system from site to site or hospital to hospital.